Welcome back to the Morning Blend. Our next guest knows a thing or two about helping people save money on their health insurance.
Yeah, he's been coming to the Morning Blend for over 6 years, and most of his advice comes down to one thing. It's be proactive. Class is in session. It's Insurance 101 with Sovereign Select. And Tom Cawley is the CEO of Sovereign Select and has great advice for anyone on Medicare or turning 65 years old or young this year. Good to see you, Tom.
Thanks for having me on.
First and foremost, congratulations. You've got a new little baby girl.
Yes.
Congratulations.
Georgia Helen.
Oh,
yeah.
So cute.
It's really cute.
Yeah,
Congratulations.
Congrats. That's Next time you'll have to bring her. We'll have to see her. Molly likes to suck on baby's cheeks.
Yes.
You know?
I'll bring a baby in.
It might not be yours, right? Yeah, I get it.
This is great. I mean, you've been coming here for 6 years, and you really help people save
flies.
a lot of money. Yeah. What does it mean to you to be able to do that, and why do you love doing what you do?
Well, you know, I see a lot of people that are in situations that are, you know, a lot of times fine, but I know there's situations that can be better. Mm-hmm. So I really do enjoy helping people to get to that next level of making sure, hey, they're saving the most money they possibly can, they're getting the right coverage on their health insurance or on their Medicare plans, and really just seeing the satisfaction of a person saying, hey, thank you very much for helping me. That is what it's all about.
Yeah.
That is fantastic. I think saving people money, especially because so many of the people that you're working with are on a fixed income, is a huge deal, so that they get the coverage they've maybe grown to expect and fully covered, but yet saving them money is huge.
Yeah.
A lot of people are just turning 65 each month, or they're about to turn 65 in the coming months. What should they be doing maybe right now to prepare for that?
Absolutely. So we're a great resource for that. And we're going to talk about our Medicare 101 classes, you know, at the end of the segment, and that's a great resource. So I really encourage anybody to go to those. But basically, get educated, you know, and we're a great resource for education. We don't charge for our services. So when people are coming up to Medicare, they're going to be looking at kind of an onslaught of information coming in the mail. They're going to be, you know, their mailboxes are going to be full. So I always say, you know what, take that stuff, throw it away, and call Sovereign Select. That's kind of the #1 thing. And we don't charge for our services. So basically what we're going to do is walk people through the steps, you know, 1, 2, 3, 4, and get through the educating them of what Medicare is and what the different types of plans are that people can go on when they're on Medicare. So when people are approaching Medicare, we run into a lot of different situations. People that are on, you know, individual health insurance plans like Obamacare or the Affordable Care Act, people that are on short-term medical plans, people that don't have health insurance at all, or people that are on an employer group plan or are already retired and on some sort of retiree coverage or COBRA. And so people always have questions about, how do I transition off of that and into Medicare? What do I do? And that's what we're here for. We're here to kind of help guide people and give them a timeline of things to really get them to Medicare comfortably without feeling overwhelmed or scared.
Mm-hmm. Yeah. Well, and you said, you know, throw those things away. What should they bring to you? Because as you're going to go over all these things, what should they make sure to have in hand? Whether you're coming to meet them, because I know you'll leave the office and meet people for coffee someplace or in their home.
Or we'll go sit at their kitchen table.
Absolutely. So what should they have for you so that you can help save them money?
Well, first and foremost, their physical selves.
Mm-hmm. Yeah, bring yourself.
Bring yourself. And then information on what their current situation is. So if they're on like an employer group insurance plan, we want to know what the benefits of that group insurance plan is and if they can keep that plan when they're going on to Medicare.
Gotcha.
Now, if they're in any other situation than like an employer group or retiree coverage, we don't really need any of that information because that's just going to end when they go on to Medicare. So we're going to kind of start with a clean slate there. But with group insurance, a lot of times they can keep their group, and in some cases, that's okay. Mm-hmm. And in some cases, that's very, very good for them to actually keep their group once they're eligible for Medicare. In a lot of cases, it's actually better for them to leave their group insurance plan and buy something privately because their group insurance might be not even a value to them in comparison to what they could buy on the private market.
Because of what they need?
It could be based on their needs, could be based on their finances, but could also just be based on the market itself, where you know, they might be paying, you know, they might have a $300 or $400 premium on their group insurance plan when they could go get something, you know, on the private market for half that.
Okay.
Your next meeting, you meet at the last Friday of each month, and the one in February, the meeting you have coming up is the 23rd of February. And people come to your office, they can ask questions, you share a lot of information about Medicare. You can review plans for people who are already on Medicare, or people who are going to be turning 65 can also come and learn more about the plans that are available to them. This is not an opportunity for people to necessarily discuss specific insurance plans and details, but it's educational, which is great.
This is a really great starting point for people. So if you're like, people come in 2 years before they're eligible for Medicare, a year ahead of time. Now I recommend usually within 6 months ahead of time to come in, and what we're going to do is really educate them on Part A, Part B, Part C, Part D, all the different parts of Medicare, Medicare supplements, and kind of how they work. It's really just a high-level overview. So it's a great starting point for people.
Yeah, and reserve a seat. Call 262-641-4111. The office is located in Brookfield. Call to reserve a spot now. Great to see you, Tom.
Thanks,
Good
Tom.
to see you,
Thank
too.
you so much.
Thanks for having me on.
Absolutely. All right.